discuss the different types of COVID-19 tests that are available. The first type is diagnostic, and this is intended to find active COVID-19 infection, and it's done by a nasal swab. One type is viral, which actually detects the virus itself, and one is antigen, which detects the protein or antigen on the surface of the virus. Both are equally effective in diagnosing a patient with COVID-19. The other type is antibody. This is done through a blood test, and inside the blood, we look for antibodies that are created in response to having been exposed to the COVID-19 infection. It is not intended to use for diagnosis of a currently infected patient, and therefore it doesn't have a great role or place in dentistry. It's really important that you don't confuse antigen and antibody. Your patients are likely going to be confused about the two types of test. So I'm going to recommend that you offer antigen testing. This way you can diagnose a patient with an active COVID-19 infection. Make sure that your patients understand that that's the purpose of this test and the antibodies will not appear. We will not know if they've previously been exposed. We will only know if they're currently infected. So what are some things to consider when you're choosing which antigen test you may want to use?